Hi. Let me first introduce ourselves to you before we start up the program. I'm Dr. Tom Babu. I'm the consultant endocrinologist and bariatric physician here at Silver Lion Hospital. To my right is Dr. Vivek. He's our chief bariatric surgeon here at our hospital. And to my left, I have a good friend and patient, Tom Callahan, who's come all the way from Australia to get his bariatric surgery done with us. Now, what I like to do in this short video is highlight two things. One is, I'm going to ask Tom here his overall expectations from prior to the surgical procedure, what his expectations were when he actually decided on doing this procedure, this weight loss surgery that we call gastric sleeve resection. So what his anticipations were when he actually decided to do this and decided to come to India. And then after the surgery, now he's sitting here 3 days after the surgery, so to see what he feels like, did the expectations match up, and what is he really thinking now 3 days through the surgery. So that'll be my first part of this short video. Also after that, we'll just get into some of the challenges that we faced while we actually approached Tom's surgery. But first we'll hear from Tom.
Well, first of all, I'd just like to say I've enjoyed all my time here within reason having surgery. My overall expectations were obviously to lose weight long term, especially because of my diabetes, and continually putting on weight no matter what I tried. It didn't sort of remiss at all. I put it on, whereas I went through the whole diet thing and off again, the yo-yoing effect, and I just had enough and decided, well, if I'm going to do it, I'll get it done by who I thought was the best and where I thought was the best, what was even more important, I suppose. So I researched for 2 years, 18 months, 2 years, and I decided on Dr. Tom and his team for several reasons. One, that the correspondence between myself and his team here at Silver Lion Hospital were absolutely first class. Two, that by going through the process of the correspondence that we developed a rapport, so to speak, and confidence in the doctor. When it comes down to it, you can read a million things on the internet or in books, but you can only get confidence by actually experience either the person or your own, what they call gut feeling. I suppose that's a funny word to use now, but yeah, so it took me quite a while to come to the final decision, but once it was made, what's it, 3 days after the surgery now, I'm leaving hospital and going shopping tonight, so, I can't say it was too bad of an experience. No surgery's ever fun, but, for the long-term benefits of it, it's minimal compared to the other alternative.
So if I can just pick up where Tom left off. So Tom I don't know if I should use that word, but he's been living with diabetes for the last 3 years, 3 years?
Yeah.
Okay. And he's been had been on like 40 units of insulin once daily when he came to us. And exactly after surgery, what we'd seen is that his blood sugars is completely normalized and he's not on any medication as of now. And we predict that for at least another 10, 20 years, he may not have to think on those lines at all. So that's something that I just wanted to highlight on Tom's case. Now, going forward, what we also encountered with Tom was that on the first go, we had a little bit of an airway problem, which we sometimes encounter in overweight people or people struggling with weight issues. So mainly because their airways, some of them can throw challenges, and Tom did throw a googly at us. But what we then did was we got together the entire team, the anesthetist, the bronchoscopist, the surgeon, the endocrinologist, all of us got together, got into a huddle, and then we figured that the best way to go is to go in with a fiber optic bronchoscope and then to actually guide the bronchoscope into his airway and then through that slide the endotracheal tube, which we did. And Dr. Vivek here can just give us a glimpse of what he went through both just before surgery and during surgery.
Good afternoon. We had actually in the first session, as I pointed out, a difficult intubation. It's an airway problem because of the anterior larynx. But that once that episode was tied over by the bronchoscopy, we used fiber optic bronchoscopy, and then everything went smoothly. And after that, the surgery was uneventful. We proceeded with sleeve gastrectomy and made an uneventful recovery. And regarding this sleeve gastrectomy, initially actually Mr. Tom was actually thinking about, was considering bypass, gastric bypass. So we had a counseling session before surgery, in which we discussed about the pros and cons of gastric bypass and sleeve gastrectomy. And ultimately we suggested sleeve gastrectomy maybe is better because his body mass index is in category 2. It's not actually severely obese, it's in the moderate category. So there is no need for a malabsorptive procedure. And second, since he travels a lot and his lifestyle is like that, it's not advisable to go for a bypass procedure where dumping syndrome and malabsorption could be a troublesome problem. So ultimately he accepted the suggestion and we proceeded with sleeve gastrectomy, and post-operatively I hope he had a comfortable post-operative recovery. So I think he should be doing fine hereafter.
So Tom is going to get on his flight tomorrow night. So we wish him well, and overall it has been a remarkable experience. Tom actually taught us a lot of things than we taught him actually, because we were swept away by his warmth and his friendliness, his sense of humor. So we're always going to remember Tom very fondly, and I hope to be in touch with him, communicate with him, and even visit him in Phuket, Bangkok, or even Australia, because I'd love to because I've found a good friend in Tom. So I think that's us signing off.
I'd just like to say one thing first, please, if I may. When considering surgery and that, in my case, I work within the industry from the outside as a tourism operator, and I found the establishment here at Skyline, the nurses, the medical staff, right through to the cleaners, to be exceptionally well trained, well mannered, and professional in everything, even down to fixing the air conditioning, by the way. But I cannot recommend Skyline and Dr. Tom's team highly enough.
Thank you, Tom. Thank you so much. God bless and safe flight to you. All right.